What's an antibiotic? Antibiotics are medications used to fight infections caused by bacteria. They treat these infections by either killing or decreasing the growth of bacteria. There are many classes of antibiotics, and certain types of antibiotics work best for certain types of bacterial infections. Antibiotics come in the form of capsules, liquids, tablets, creams, and ointments. How do antibiotics work against bacteria? Antibiotics treat bacterial infections by either killing the bacteria or slowing and suspending its growth. This can be done by attacking the wall or coating surrounding bacteria, interfering with bacteria reproduction, and blocking protein production in bacteria. How long do antibiotics take to work? Antibiotics start to work right after you take them. However, it takes about 2 to 3 days to feel better. What is antibiotic resistance? Antibiotics work very well for certain types of illnesses. However, some antibiotics become less useful than they once were due to an increase in antibiotic resistance. Antibiotic resistance occurs when antibiotics can no longer control or kill certain bacteria. When antibiotic is taken, the sensitive bacteria are eliminated. However, those that survive become resistant to that antibiotic. They develop unique characteristics that prevent antibiotics from working on them. Steps to take to decrease inappropriate antibiotic use. Take antibiotics only for bacterial infections. Don't use them to treat conditions caused by viruses like the common cold, cough, flu, or sore throat. Take antibiotics as prescribed by a healthcare professional. If you use the wrong dose, skip doses, or take it longer or shorter than directed, this might contribute to bacterial resistance. Take the right antibiotic for an infection. Using the wrong antibiotic might lead to resistance. What are antibiotics used to treat? Antibiotics are used to treat bacterial infections like sinus and ear infections, strep throat, and urinary tract infections. Antibiotics aren't effective against viruses, nor do they work on infections caused by fungi such as athlete's foot, yeast infections, ringworm, and fungal toenail infections. Common side effects for antibiotics. Most antibiotics have similar side effects. The most common side effect is gastrointestinal upset, including nausea, vomiting, diarrhea, and cramps. In some cases, these side effects can be reduced if the antibiotics are taken with food. However, your doctor might ask you to take some antibiotics on an empty stomach. A GI upset usually goes away after you stop taking antibiotics, but if it doesn't, you should call your doctor. You should also see your doctor if you develop fever, severe diarrhea, or stomach pain and cramping. Taking antibiotics effectively. Antibiotics are very effective if used appropriately. This starts with using antibiotics when you need them. Talk to your doctor or pharmacist about the best way to take your antibiotic, whether with food to reduce side effects or on an empty stomach. Also, antibiotics should be taken in the amount and directed length prescribed by your doctor. Even if you feel better within a few days after starting the antibiotic, make sure you talk with your healthcare professional before stopping your treatment.
Thank you for watching our video. Please do not forget to like and share the video. Also, please subscribe to the channel to stay updated on our latest videos.